welcome to the Housing Safety and Community Committee meeting. I am Victoria Watlington, serving at large and your chair. We're going to start today with introductions in the room.
Councilman Watlington, can we hold 1 second? Can we turn up the volume in the room? Yeah, we couldn't hear you.
Can you hear me now?
No, I mean, sorry, we could hear you, but we couldn't hear you. It was
The volume issue.
the volume issue in here. But we can go ahead and get started with the introductions.
Awesome.
Online? Councilmember Johnson?
Hi, I'm Renee Johnson, District 4 Committee Member.
Who else is online? Councilmember
Vice Chair
Mayfield?
Mayfield.
Good evening, Councilmember Mayfield, Councilmember at Large, Vice Chair.
Councilmember Bakari?
I see Councilmember Brown.
Oh, Brown. Maybe that's Brown.
Yes, Councilmember Brown, Charlotte City Council, District 3.
Welcome. Anyone else online? Then let's turn to the room. We'll start at the end with Rakisha.
Rakisha Stewart, Deputy Director, Housing and Neighborhood Services.
Rebecca Hefner, Housing and Neighborhood Services.
Sean Heath, City Manager's Office.
Renee Askew, City Manager's Office.
Harold Thompson, Housing and Neighborhood Services.
And a whole host of guests. I don't know if we want to go through and go through the guests. Do you want to go through the guests? All
Let's
right,
do it.
Awesome. All righty. Well, thank you for joining this special meeting. We wanted to get together to make sure that we gave due diligence to our response to our juvenile justice work around the city. We know that we have spent a good bit of time with staff and with our community partners outlining a strategy to address crime in our area, specifically crime that involves youth. And so what we'd like to do today, with an eye on the upcoming budget, is take a look at what particular options are and think about how that might frame our resources going into the next fiscal year. So with that, I will turn it on over to staff.
So I'm not going to take any time, as Renee Askew. I do want to hand it over to Sean Heath, who will really open up on the great work the team has done around youth crime and some of the recommendations. Sean?
Thanks. I'll just quickly acknowledge the team, thank them for the work, as well as our various community partners that have been deeply engaged. And with that, I'll do a quick handoff to Director Hefner.
All right. Good afternoon, everyone. Oh, we've got some echo action here. All right, let's see if that's a little better. Little? Okay, well, we're going to just roll with it. It is not our usual committee day and time, so maybe we're just a little out of sorts here as we settle in to a Thursday afternoon committee meeting. Want to recognize also Rakisha Stewart, whose team has done a lot of work on this. And again, I'm Rebecca Hefner, Housing and Neighborhood Services. So let's advance to the next slide, please. As a reminder, the policy referral that came from Mayor Lyles was for the committee to evaluate and recommend strategies to support meaningful reductions in juvenile crime rates over a 5-year period. So this is, of course, an emphasis on youth age 17 and below. And as we've walked through these discussions and analysis, we've really focused on what are the mix of programming, investments, and policy, whether that's in the city's direct control or not, that can really be taken to meaningfully impact youth crime and violence. Next slide. We've come a long way together around this topic, from the referral in February to some insights from the data in March and a conversation with Mecklenburg County's Office of Youth Violence Prevention staff, who, by the way, were in Washington DC this week, so great opportunity to represent the collaborative work that's going on here in Charlotte-Mecklenburg. In April, we talked through benchmarks and best practices. You heard from Dr. Alexander from the UNC Charlotte Violence Prevention Center. We looked at our existing programs and policies, and then talked about the youth engagement process. And so here we are today in May to share with you a summary of stakeholder feedback, some of the insights from youth engagement, but we'll really focus today on the preliminary recommendations and some investment opportunities for council that come, have some cost estimates along with them, given the budget process that's underway right now. Next slide.
Thanks, Rebecca. This is Sean. So momentarily, you're going to hear more about some of the youth engagement over the last 30 days, which I think will be great. And before we jump into that, I just wanted to remind the committee that earlier in the process, we reached out to roughly a dozen local agencies and community partners that all have a vested interest in this particular topic, just asking for some feedback and some input, making sure we had a good grounding in all of that. And just to give you a flavor for the types of organizations we were in contact with, a number within the Mecklenburg County umbrella, including the Office of Violence Prevention, Sheriff McFadden and his office, Criminal Justice Services, the court system, Charlotte-Mecklenburg Schools. We had check-ins with a few nonprofit partners that are involved and engaged in this space, including Heal Charlotte, Freedom Fighting Missionaries, and Action NC. At the state level, we've had numerous conversations with leadership, both state and regional, local folks from the Division of Juvenile Justice, and then, of course, CMPD has been actively involved along the way. So just quickly here, going across those various conversations, I wouldn't suggest that every single person we spoke with would agree with each item on the slide, but as we reflected on what we were hearing and tried to distill that into some recurring themes, these are the things that emerged. So I'll go through these rather quickly. But first, just to reinforce, as a community, we're not starting from a blank sheet of paper. There's a lot of activity happening within this ecosystem. So as we've embarked on this work, we want to be mindful of that. We're looking for opportunities to fill voids, to fill gaps. How can we harness momentum? How can we dovetail our efforts? How can we scale things that we're doing that are working, or possibly provide support to other organizations that are doing things at more of a pilot level and could potentially take it to the next level? Number two, we've talked about raise the age before, and I think the way we framed it is really kind of almost or universal recognition that raise the age was and is smart policy. And the state of North Carolina did, in fact, inject a lot of resources into communities across the state in association with the changes around raise the age. But nevertheless, there's still an additional need for state-level resources to fully realize and activate on the initial policy vision related to raise the age from a few years ago. Number three, just a recognition that as we're talking about the youth in particular, that it can't be denied that the home environment that they're in plays a big role. Both in terms of prevention efforts as well as scenarios where folks are returning back home. So that's something we've had our eye on, is an emphasis on what are the opportunities to engage beyond just the individual child. Number four here, related to community level evidence-based violence prevention strategies. I'd mentioned Robert Dawkins in particular, who's in the room today. And early on, he brought some ideas to our attention, things that the CDC is doing across the country in different communities like Louisville around violence prevention center strategies and social norm campaigns. And you'll hear a little bit more about that in our preliminary recommendations. Number five, this has been a point of emphasis for us all along, and certainly something we've heard a lot from the community, the idea that as youth are encountering the justice system, there are and should be many opportunities along the way for them to either be diverted away from the justice system, or in those instances where they go through the full process and there's a disposition order, any community needs to have a suite of robust alternatives beyond a juvenile detention center. Number six, somewhat related to that, and we talked about this a bit at a previous committee meeting, the relevance and connection point between mental health and juvenile crime related activity. So the Division of Juvenile Justice state level data tells a story around mental health and the connection point to juvenile crime. The youth engagement that you'll hear about in a moment connects the dots between mental health and juvenile crime. And then, anecdotally, in the conversations we had with many members across the community, I think there's recognition there as well. One of the recommendations that we'll discuss later in the presentation is something that we believe is a compelling opportunity for consideration, referred to as the Katie Blessing Center. So more to come on that, just put a pin in that for now. And then number 7, we've talked about this before, the closure of the juvenile detention center here locally in 2022. Just to cut to the chase here, in our recommendations that we'll discuss later, there isn't anything specific that we're recommending the city do at this point, other than continue to engage in conversations, monitor the situation. I think that our police chief and other members of the community locally and at the state level have all been very consistent in recent months in public settings, suggesting that while as a community we always want to do everything possible to avoid having juveniles in detention, in those instances where detention is necessary, we as a community are in fact much better off having a juvenile detention center here in our backyard. There's, as I said before, there's no community that will wrap itself around our kids to the level and ability that we will if we have a detention center here. So it's really not our role to be in the driver's seat for this. We're still involved in conversations. It's an accountability for the state of North Carolina itself. Of course, we have Jail North, which closed a few years ago, and there are a lot of questions as to whether that would be a suitable location to reconstitute a juvenile detention center. But for our initial wave of recommendations, it'll be nothing more than continue to engage and monitor. So I will transition now to youth engagement.
Thank you, Sean. So we talked about the plan for youth engagement at the April committee meeting, and also throughout have emphasized the importance of getting youth voice into this process. And so the team did a fantastic job over a very short time frame to engage youth around the topic of youth crime and violence prevention, along with a whole host of our partners. So we participated in listening sessions and conducted tabling at community events, distributed a survey, and our staff had the opportunity to join the youth town hall that was hosted by Councilmember Brown. So we have a number of data slides in here, which I'm going to move through fairly quickly, just touch on a couple salient points and then get to the insights. So next slide, please. This slide just represents the youth that we heard from, and a couple of things. One, the team did a great job. We talked to youth from 39 schools and 33 different zip codes. But I think also if you look at the map and the demographics, we really, as a city, can't always reach the most at-risk or disengaged youth. They may not trust the city or you trust in local government and institutions. And so this underscores to me the importance of our partnerships in order to more broadly reach our youth. Next slide. Some of the things that were asked about on the survey in particular were about youth interests in different activities and what challenges youth were experiencing. I think an important takeaway from this slide is if you look at the challenges and the top 5 there, the first one noted is not feeling heard. And that's followed by mental health needs. Youth say they experience bias. That might be race, based on race, ethnicity, gender, ability, or others. The fourth one there, not having enough money, and the last one, family conflict. So you'll see that come up also again in some of the themes. Next slide. There was an opportunity for free response for youth to share with us in the survey about their feelings of safety, and then in also some of the listening sessions and in the town hall, we were able to get some more of that free response. And I think one of the most important takeaways is that youth reported that being around people they trust, which is largely reported as family and friends, and being in comfortable and known environments are part of what made them feel safe. So notably, 93% of the youth felt safest at home compared to either school or in the community. Next slide. So this is a long list of insights from the youth engagement. I want to hit on a couple of important themes. Many youth that we heard from expressed a sense of not being heard and not being valued in decision-making processes. And that was especially when those decisions directly affect them. So I think that having this youth engagement process and then continuing our engagement with youth around this topic is going to be very important for that trust building. Awareness and access were two themes that came up time and again. Often youth said they didn't know about programs or opportunities, or information was geared towards parents or guardians, or they just weren't accessible, whether that's due to transportation or not being located in areas that, neighborhoods where they could access. And then finally, I just want to note that we observed and heard what was kind of an overall sense of frustration and fear. So one of our staff shared directly with me that many of the youth they talked to shared how scary it is just to go through a lockdown, or how they wonder if they will be able to see their family members when they, again, when they're waiting to walk through the metal detectors, or how they have been directly impacted by gun violence. And some of the youth also shared that they feel we've really become complacent as a city. So I think the sense of urgency for action emerged as well. Next slide. So we've brought to you today a list of preliminary recommendations. So this is incorporating your priorities that you've shared with us over the last couple of committee meetings, incorporates what we've heard from our youth engagement process, the feedback we've gotten from stakeholders, and the insight that was shared on the evidence and what works by our colleagues at the UNC Charlotte Violence Prevention Center. So these recommendations, they intentionally build upon your existing investments and our partnerships with Mecklenburg County and the Office of Violence Prevention. So how we've structured this is really trying to acknowledge that this is a long-term body of work. Staff have estimated some preliminary costs around these recommendations over a 3-year investment period. So just taking a look at each of these, there's a little more detail in the rest of the presentation. But the first recommendation here is expanding inclusion of at-risk and justice-involved youth in our workforce and employment programs. This recommendation also includes kind of a broader recommendation about fully incorporating best practices into the city's youth programs. The second recommendation here is around expanding and scaling the youth programs within CMPD. Third, expanding your community-based investments in what works. So ensuring that the investments that we're making are research informed and also have evidence of effectiveness, which pairs well with the next recommendation, which is having clear goals and measurable outcomes. Can you go back? Thank you. And evaluating both the city programs and partner investments. And then the next one here, as Sean mentioned earlier, is an investment in the Katie Blessing Center, a new youth behavioral health care facility here in Charlotte. And finally, expanding and scaling pilot efforts and partnerships in the corridors of opportunity. So the city manager's budget included proposed funding for this body of work. So we wanted to make sure we gave you some initial cost estimates to see what that funding might be able to do. And this is really thinking about breaking it down into a year one, phase one. So the corridors of opportunity work, you'll note here, that item is already included in the proposed FY 2025 PAYGO allocation for the corridors of opportunity. So that's altogether a $5 million allocation, and if that moves forward with your budget deliberations, those components will be funded. if you take all of the other recommendations there, the first 5 from Workforce and Employment down through the Katie Blessing Center, and you break that up into a year 1 investment, it's about $4.5 million. And again, high-level cost estimates. When we get council feedback around what is of most interest to move forward, we will refine those before proceeding. Next slide. I'll walk through each of these recommendations in a little bit more detail. So the first one here, expanding inclusion of at-risk and justice-involved youth in workforce and employment programs. Again, this is a two-parter. The first being to fully incorporate best practices into all of our existing programs. So you'll recall in the program guide that was shared as part of this referral, there's a variety of youth programs across CMPD and Housing and Neighborhood Services and the Community Relations Committee, as well as a number of youth programs that the city funds through your investments. And so some of those are specific to violence and prevention, and some of them are not. Either way, incorporating best practices will make them more effective and will also make them better protective factors for our youth. The second part of this is really that focus on expanding inclusion of at-risk and justice-involved youth. That could be in our Mayor's Youth Employment Program, our Job and Career Readiness Training, and also in the workforce programs that the city funds as a partner. Some of the things that we know, the youth programs team has worked really hard this year on expanding inclusion, specifically in the Mayor's Youth Employment Program. And we heard you loud and clear that this is a priority. So under Rakishla's leadership, the team has advanced some of this already, including most recently the Job and Career Readiness Training that was delivered at Turning Point Academy with both our youth team and our community safety team. So we've had great success to date, but there is more work to do. The other component of this that we think is really important, and we heard from you, is establishing a system for helping youth move back and forth between our various programs. So for example, making sure that youth who participate in youth diversion then have also an opportunity to participate in the youth employment program. And youth who participate in our middle school programs have an opportunity to become ambassadors or youth fellows or participate in youth employment programs in high school. Next slide. The next recommendation is also related to city programs, and this is around expanding and scaling the youth programs in CMPD. So you have heard probably several times from the chief about some pilot programs that have been taking place in CMPD over the last year that are seeing really great initial success. And we think there's a good case to be made for expanding these pilot programs. So Fifth Element, you may recall, serves youth aged 13 through 17, really focused on community partnerships that create a network of resources. That might be mentors, life skills training, occupational training, career coaching, and then also monthly activities with police officers. So this was piloted in 2023. There's been great demand for it, and CMPD is ready to fully launch now in 2024. The other pilot program, the JADE Initiative, which stands for Juvenile Accountability and Diversion Empowerment. This is a team that conducts juvenile investigations, but also then conducts outreach to some of Charlotte's most at-risk juvenile offenders and works to connect those youth and their families to critical resources. So those are some of the exciting pilot programs that CMPD has been working on that we believe are ripe for expansion. And then this would also include some additional investment in current programs like Envision, REACH, and the Police Activities League, and some of the training work that's done through CMPD serves. And what's important about these programs and being within CMPD is that They create opportunities for prevention, diversion, and intervention. They're also focused on positive youth development. Some of them have workforce development components, and then really looking at creating that positive relationship between community and police. So a lot of opportunity there. Next slide. So then, in addition to current city programs, we have some preliminary recommendations for you around new opportunities that you may want to consider. So the first here is a package of activities under the heading of expanding community-based investments in what works. And so here we're looking at things like a youth-led social norms campaign that Sean referenced, mentoring, mental health awareness, and expanded capacity for grassroots organizations. I'll tell you a little bit about each of these and how it connects to what we learned and why we think it would have impact here in our community. So the Youth-Led Social Norms Campaign, this is an evidence-based methodology from the Centers for Disease Control, so it's aligned with the public health model of violence prevention. It's also a component of Cure Violence and our violence interruption program implementation. An example of this social norms campaign is one that Councilmember Mayfield referenced and Action NC shared with us. It's called the Pride Peace Prevention Campaign in West Louisville. And so this is really an opportunity to employ youth and as youth fellows to design the campaign and then equip them to deliver these messages, to create community norms that are different from what we see portrayed in media, and also help young people understand the conditions that they live in and that often lead to violence, victimization, or perpetration. So the second one here is all about mentoring. So mentoring, you may know all about the positive research around mentorship, that really creating caring, positive relationships with youth and adults in any setting is a protective factor. So mentoring in general can be very positive, but this is more specific. If we want to get to prevention or diversion, we have to be more intentional about the type of mentoring. So this but this takes additional skills, it takes additional training for staff and mentors. Mentors need to recognize trauma response and understand, just as we talked about for our own staff, trauma-informed care, as well as cultural responsiveness, and also things like mental health first aid. There's also, for every mentorship program, a long waiting list of people looking for mentors, so recruitment would also be a component of that. The next one here is community-wide mental health awareness and skill building. We've heard this from you all, we heard this from the youth, we heard this from the research, we heard this from everyone. So one of the options here is mental health first aid. So this is a program that teaches the knowledge and the skills to recognize and respond to individuals experiencing mental health challenges. This is a program that's available to both youth and adults. I can say I've participated in this. Our staff, we've offered it to all of our staff. It's a very valuable resource around skill building. It's also a key strategy of the Mecklenburg County Behavioral Health Strategic Plan. So a draft of this was released earlier this month, and mental health first aid is a key strategy within that behavioral health strategic plan. The last one here is expanding capacity building for grassroots organizations. Again, we have we acknowledge that this is not something that we can do on our own. It takes a lot of partners, and it takes, in particular, partners who are working in community, have the trust of community, and can really serve to deliver services and programs in ways that we're not equipped to do. And so we want to be able to expand that capacity building for grassroots organizations. Under the Safe Charlotte grants, for example, there's a capacity building component within that, and we think that has been working well for grantees, and we think there's an opportunity to expand it. Built into all of this around what works is really understanding what impact we're having. So this idea of establishing goals and outcomes for youth safety and youth violence prevention investments, we think there's an opportunity to partner with UNC Charlotte, both the Violence Prevention Center and the Violence Prevention Data Collaborative, to really better track and monitor and measure participation and impact both in the city programs and the programs that you all invest in as partnerships. Next slide.
This is Sean again. Okay, so turning back to the Katie Blessing Center, what I wanted to do is try to paint a picture of the investment opportunity. This is the one on the menu that's a project investment, a capital investment. So I'd like to go through the what, the why, a little color commentary around the intended service delivery model, and then some perspective on project status. So I will pace through this as quickly as I can. First, with the what. So the vision here is to construct a 70,000 square foot, 72-bed youth behavioral health facility targeting youth in the range of age 5 to 18. The facility would be owned and operated by the Katie Blessing Foundation, which is a 501c3 nonprofit established by Mike Estramonte from Starmount Management. The location of the facility will be on Central Avenue. This was previously city-owned land. You may recall council approved in January of 23 a sale of this parcel. It was a market rate sale. This would be a first-of-a-kind facility in North Carolina in terms of being the largest pediatric care facility offering a full continuum of behavioral health services on a single campus. And with that last point in mind, it's really not an exaggeration to say that this would help put Charlotte-Mecklenburg really at the forefront of youth behavioral health. In terms of the why, in terms of why we're bringing this to you and why we think it's connected to the policy referral, it's two really straightforward points. One is we need more capacity like this in the community. Charlotte-Mecklenburg is not unlike communities across the state and across the country in terms of having a deficiency in terms of access to youth behavioral health care. The demand far outstrips the supply. It's really as straightforward as that, and especially for disadvantaged youth without private insurance. The second key point is, based on some comments that were previously made, we do see a direct connection between youth mental health services and juvenile crime. As I mentioned before, we feel the statewide data tells that story. The local experts have that narrative, and our youth themselves have made that connection. In terms of the intended service delivery model, this is really the defining attribute for the Katie Blessing Center. So the whole idea here is to have a multifaceted facility addressing a range of youth behavioral health needs on site. And to break that down into the four key component pieces, first would be behavioral health urgent care. So this would be for scenarios where an individual would be on site for up to 23 hours. This could provide a great alternative for CMPD and other partners as opposed to having to go to the emergency rooms here locally. The second component piece is acute inpatient hospital, which would be an average stay of 3 to 14 days. The third component piece would be a residential treatment facility, which would be the long-term stays in excess of 30 days. And the fourth would be traditional outpatient care. I would point back to the residential treatment facility that I just mentioned. In some of the conversations we had with the Division of Juvenile Justice folks, one thing that emerged in those conversations was their belief that there is truly a void here locally as it relates to access for individuals, some of these more intense cases of youth that are in the juvenile justice system. where there's a need for a disposition outcome other than juvenile detention, and it's hard to find access for these individuals to residential treatment facilities. So that's one key feature that would definitely have a very direct connection point back to the policy referral. In terms of project status, you can imagine for something of this magnitude, there are a lot of plates spinning right now around design and staging the general contractor, licensing work with the state of North Carolina, teasing out the staffing model, and then fundraising, just to give you a sense for the overall numbers that are in play here. So the overall estimated total capital investment for the project is $62.5 million. There are committed fundraising to date is $37.5 million. It's worth peeling the onion back on that layer just a bit, because $20 million of that is coming directly from the Katie Blessing Foundation itself. So they have real skin in the game here. And it's also noteworthy that $17.5 million has been committed by the North Carolina General Assembly, kind of demonstrating state of North Carolina's commitment to behavioral health as a key priority. There are also $25 million worth of asks that are in flight, including $12.5 million with the North Carolina Department of Health and Human Services, and then $12.5 million across a range of Charlotte-Mecklenburg local, public, and private sector potential funders. So we would be one small piece of that overall $25 million ask that is in flight. So if you think about the $2.5 million compared to the overall size of the capital investment, this compared to other, and I'm reluctant to name specific names because these are all kind of very unique scenarios, but if you think about a lot of the things we've done over the last couple of years in providing support for various types of capital projects, like innovative entrepreneurial projects, this is a very attractive leverage ratio if you think of 2.5 million as a very small piece of the overall investment. There's also the potential to get some of the local fundraising moving, build some more momentum with one local investment potentially allowing some other dominoes to fall at the state and local level. So that's kind of the 30,000-foot view. I'll stop there. We're almost done with the slides, and then, of course, we'll be available for questions.
Next slide. Can we advance? Next slide, please. Excellent, thank you. All right, we put this one a little bit outside of the others here because this is a component of the Corridors of Opportunity proposal, but it is, of course, of direct relevance because this is looking at expanding and scaling the pilot programs related to youth in the Corridors of Opportunity. So the manager referenced in his budget presentation the great success that the team has been having with youth programs in the Corridors of Opportunity over the past year, a really exciting partnership with Teach for America and the Mayor's Youth Employment Program that has allowed us to, I think it's triple the number of youth from the corridors who are engaged in the Mayor's Youth Employment Program this summer. They're getting started next month, so it's very exciting. Where Teach for America teachers will be serving as team leads and group mentors over the summer for those youth. We also have some exciting work going on with our youth engagement and youth safety team, targeted engagement and connection to resources. This is in particular in apartment communities where there are a large number of youth. So for example, under the city's Neighbors Building Neighborhoods umbrella, and we've been engaged in a partnership with In Livian out at Little Rock to provide resources and help connect youth to activities out at the Little Rock community off of West Boulevard. And then the team has also piloted some career exposure programming activities for youth ages 13 to 15. And of course, at that age, it's also supporting youth and their families. And this is creating opportunity for youth at a younger age, which we've heard a lot, is this 13 to 15. There's not enough opportunities. And it also creates an initial interest and a potential pipeline for younger youth into our workforce and employment programs once they reach high school. So again, this is a proposed $1 million that is already included in the FY 2025 proposed allocation for corridors of opportunity. Next slide. All right, we're rounding it out here. So the last two slides here are focused, this one on advocacy and the next one on kind of the continuation of great work that's already happening. So as we think about advocacy and intergovernmental collaboration, what we have heard is the need to advocate for increased state funding for juvenile justice, as Sean referenced in the opening about the feedback from our stakeholders. This is really to address the demand for intensive programming, family-focused interventions, staffing, and system coordination for juveniles, especially 16 and 17-year-olds after the implementation of Raise the Age. The second recommendation here is, again, to engage in stakeholder discussions, to identify what are those short and long-term solutions to address the void created by the closure of the local juvenile detention center. And so again, as Sean referenced, this would not be the city leading these conversations, but participating in them to learn about ways that the city really can engage in addressing that void. The last piece here is the continued collaboration with Mecklenburg County to advance the Community Violence Strategic Plan, which is called The Way Forward, that we heard about in committee from Tracy Campbell a couple of months ago. I would also say, I would add to this bullet point that also to work to align around the recommendations in the recently released Behavioral Health Strategic Plan because of that really strong connection between mental health, behavioral health, and youth. Next slide. And finally, you're already doing great things, so let's keep them up. Through the Safe Charlotte grants that Council has authorized the last couple of years, we've been able to partner and build capacity of several impactful grassroots organizations. The Safe Charlotte grantees, this most recent round, were focused on youth violence, so we'll have the implementation of that over the coming year. Of course, the two evidence-based programs that have been implemented over the last several years in Charlotte, the Community-Based Alternatives to Violence and Project Boost, the hospital-based violence intervention program. Those have both been supported by the city and the county and then been able to leverage federal funds and other private donations to continue that good work. We want to continue to reduce recidivism through the Youth Diversion Program. We've talked in committee previously about the effectiveness of that program. Continue to advance the work of the Violence Prevention Data Collaborative because we still have a lot to learn about what is working and where to put our investments. And then just to continue the investment in the strategic priorities of the city. They are of direct relevance to creating healthy neighborhoods and healthy families. So continuing that investment in corridors of opportunity and affordable housing and workforce development. And finally here, continue the conversation with youth to shape the priorities and the investment with youth voice at the table. Next slide. Next steps here today, committee discussion and feedback, and then based on what we hear from you today, working to align recommendations and investment opportunities with the FY 2025 proposed budget. And with that, if we could go back, please, to slide 11. I know that given the timeliness with the budget, that the numbers and the cost estimates are top of mind. So just want to bring us all the way back full circle to the preliminary recommendations and say that the package of recommendations reflected here for a year one, phase one implementation would be about $4.5 million. So with that, I will pause and turn it back over to Chair Watlington.
Thank you so much. I know that Vice Chair Mayfield has a couple questions, so I will recognize her.
Thank you, Madam Chair. Team, thank you for this really detailed presentation. You all have done some amazing work in collaboration with our community partners as well as the county. I have a question, Rebecca, you or Sean might have the answer to. When we were looking at the youth that have already been connected in some way through our juvenile justice system, are we also tracking how many of those youth are unhoused and or in unstable housing?
There isn't any central data source on youth from the juvenile justice system, in part because those records are closed because they deal with juveniles. And so while we haven't done it in the past, the opportunity that we do have, especially if we have some ability to invest in kind of the data infrastructure and the evaluation, is to learn more about the range of needs that youth have when they're participating in our youth programs or in our partners' youth programs. So that's a long way of saying no, and that we think there's a real opportunity to connect the dots a little bit better.
So that's something, excuse me, I'm really interested in when we think of the large number of youth that we have in foster care and what happens after aging out, even though we're only focusing on 13 to 17, a lot of youth that are unhoused or in unstable housing. Someone should be tracking if any of the youth that have had any interactions that led to a conversation with law enforcement. We need to be tracking that because that falls directly in our housing and neighborhood services. As far as having stable housing has a major impact on quite a few of these conversations. I will say, as far as the youth behavioral health care facility, I am glad to see that we are moving forward with a recommendation. That is something that myself and colleagues supported because we don't have this in the area, and that will be a major impact. And what we didn't talk about is also the impact on families when the children are an hour and a half or more away trying to stay in their lives and work on family dynamics and relationships. So I'm glad to see that that's there. Of course, you already know the big conversation and the big question in this budget. We're trying to figure out how to cut the budget. This right here is not helping in that particular conversation of where we make necessary cuts. But I do appreciate all the work that you have put into it. So I look forward to hearing the questions that come up from my colleagues. Thank you, Madam Chair.
Thank you, ma'am. I don't see any more hands raised. Does anybody else have additional questions or feedback?
Mr. Watlington, I do. I want Chair Watlington.
Sure.
Thank you so much. I wanted to ask about, I didn't see where the youth prevention centers is listed. And that's something that we mentioned being funded. Did I miss something, or did something go over? Or we just get like an overall? Just trying to figure that out.
Councilmember Brown, are you specifically referencing a youth violence prevention center, the CDC model that's an academic and community and youth collaboration?
I am.
Okay, so there's not a recommendation in here to fund a specific Youth Prevention Center. But the range of recommendations include investing in partnerships with our local academic institutions, with our youth to design and lead social norms campaign and potentially other violence prevention activities, and several other community-based, community-wide interventions. And so while there isn't a specific line item for a youth violence prevention center, we think that there are the components of that in here that we could get started with and then look at a more formal structure and partnership over time.
Okay, thank you so much for answering that. I really do appreciate it. I also hear you mentioning some of the nonprofit organizations that work with youth. What about some that were mentioned in our meeting on Monday night, but were not included in this? Is this just something for us to go on and then we can add and subtract, or is it pretty? I just have those questions surrounded about some of the ones, and I know I remember Councilmember Mayfield saying that as well about some of the organizations that we don't fund that are doing great work. I like what you presented, but it is a wide scale, and I'm just concerned about some of the youth organizations that we mentioned, but I didn't hear them. We can always bring those back to the forefront. I know I mentioned Save Our Children's Movement in District 3. I know Melina had said something about Promise Youth Network, and we was doing something with a van. I know that, maybe it's on a different scale somewhere else, but I'm just concerned about some of the organizations that are doing great work with our youth that I didn't hear.
Thanks for referencing that. I think there's two things there. One is these recommendations are scalable. As Councilmember Mayfield shared, right now the scale looks a little large compared to trying to cut the budget. The recommendations are also scalable to include more of one or another of these items according to your priorities. And as it relates to specific youth-serving organizations, within the expanding community-based investments in what works, that piece includes looking at additional capacity for grassroots organizations, but it would be premature at this point to identify specific organizations that could be served by that funding. But we have heard from you all, as well as a number of our youth serving organizations in the community, about some great opportunities that are out there.
Well, I just want to commend you for your work. It takes a great deal of time, investment, working, researching, digging, listening sessions, sitting at tables, leaving tables, adding tables, subtracting tables. So all the work that you've done is just amazing. But, we got to try to find some type of common ground where we're trying to reduce the budget. So it'd be interesting to see what we come up with in the committee with all of the expertise that's been put into the compelling this and getting this together for us and see how we can move forward. But I don't have any other questions at this moment. The presentation is plain, cut and dry, very easy to follow and understand, and the data and everything that you mentioned. So thank you.
Thank you. I think that brings up a good point. One thing for us to keep in mind as we are having these budget conversations is that some of these dollars that we see actually will cover some of the things that we have lifted up specifically that have not yet been specifically programmed. So I think as we're having these conversations, the more that we can match some of those items that we have specifically called out in regards to organizations like Save Our Children, knowing where they can plug into these budgets would be helpful. I'm not asking you to go and do a specific exercise, but just something to keep in mind that as we're looking at the overall picture, that we have an idea of where we can fund particular specific items within our existing budget. And I think that goes back to the conversation around what's been what's been set aside or budgeted for specific areas, but not yet programmed. And I know Rebecca, I can't remember your last name right here. Hefner, Director Hefner, forgive me. I know that you're doing that work now to identify what are some buckets that may just not yet be at capacity that could be opportunities to still achieve what it is that we're looking to do from previous funding. So if you could speak to that a little bit, that would be great. And then I see that Councilmember Johnson has a question.
Thank you, Chair. Thank you so much for that, Dr. Wallace.
Sure, I can speak to that question just a little bit, Councilmember Wallington. So the staff in the budget office actually are doing a broader analysis about where there might be some existing capacity. We did take a look within the funds that Housing and Neighborhood Services manages to look for additional capacity. There are what I would call drips and drabs. There's $250,000 still in Safe Charlotte, for example. So there may be smaller pieces within the funds that housing manages, and then you'll get a more comprehensive answer on that question from the budget staff in your upcoming Q&A.
Awesome, thank you. Ms. Johnson?
Thank you, Madam Chair. So I want to thank the staff for the presentation. I remember the last meeting. I'm trying to see, there we go. I remember the last meeting, we spent an hour talking about evidence-based models and Dr. Alexander, I think that was her name, Dr. Alexander's presentation and the importance of trauma-informed care. And then at the end of the meeting, Sean, Mr. Heath, mentioned the Juvenile Detention Center, and that seemed to be the only thing that made the news. And it was discouraging and disappointing. So I'm very happy to hear this presentation that we are incorporating many of those suggestions and the tone or the intent, I think, of this committee. I think we should remember this date, May 23rd, 2024, as a historic date in Charlotte. We're talking about a behavioral health center for the youth. We're talking about trauma-informed care, justice-involved youth and at-risk youth, and being intentional about breaking cycles and providing solutions, evidence-based solutions to stop that cycle of violence and reduce youth violence. So I'm excited to support it. I agree with my colleague as far as my colleagues as far as the budget. We were discussing just the other day ways to reduce the budget, especially given that the property tax increase is included. So we have this dilemma where we're trying to balance the needs of the city versus the other needs of the city. So I'm curious to know or to see where these numbers have already been included or calculated in the proposed budget and how we can pay for this. But this is certainly something that I want to support. I appreciate the fact that the youth detention center wasn't mentioned, but we were looking at more of these person-centered approaches or human service approaches. So thank you so much. I do have a question on the workforce development or the jobs. And it's interesting. I just spoke with our workforce development manager yesterday and talked about the need for jobs for the youth, the at-risk youth. So this is it's just a great presentation. I'm excited and honored to be here today. I wanted some information, if you could talk to me about the mayor's youth program versus this other program that we're proposing, because one of the requirements for the mayor's youth program I see is a background check. So are we looking at this being two different programs, or are we increasing funding for Mayor's Youth Program and removing that requirement for the background check for eligibility? What I would like to see is one program so the youth are not divided versus at risk.
I think we may have lost
We lost your
Councilmember.
sound.
Madam Chair, do you think that was enough of the question for?
Yep.
Go ahead.
We lost you.
Oh, you did?
Yeah.
What I heard was a question about the Mayor's Youth Employment Program, so let me try addressing that, and if I missed the mark, we can try again. So it's a great question. Our intent is actually to broaden and revise our youth employment program so that it is inclusive of all youth, all at the same time. When we say expand inclusion of at-risk and justice involved, we say that because the current requirements of the program make it difficult for all youth to participate. And so this would include revising the current program and then adding in some components around programming and case management and potentially even stipends for clothing and transportation that make it possible for all youth to participate in the same program. And what we know is that if those programs are trauma-informed and culturally responsive and evidence-based, that benefits everyone.
Yeah, because that.
Perfect. That's exactly what I was saying. I didn't want to have, because the mayor, one of the eligibility requirements in the Mayor's Youth Program was background check. So I didn't want to have those two programs, one for the at-risk youth and one for, the mayor's youth, and an obvious difference in the way that the children would be perceived and treated. So I think that that's very important. And that's what I was saying. I think that's perfect in the way that they see themselves and the way they're presented to the community and to society. So thank you. I'm excited. This is great work, Rebecca. Thank you. And Sean and the whole team. So thank you.
Ms. Brown, did you have something?
You know I have something when they say background. I'm about to fall out my car. Yeah, thank you, Councilwoman Johnson. Background check. I don't even know why that's a thing in 2024. Maybe, a reference letter or character letter or something. But our children sometimes get scarred and put in a position where their background just hold them back at an early age, and it follows them forever. Like the first time I got in trouble, 16, still follows me at age 52. Is that fair? So that definitely is something that we need to look at. It disheartened me to hear that.
Yeah. Well, they're removing it. So, currently, if you go online, it's there for a background check for that program. So this is growth, and so they're proposing to remove it.
It shouldn't be proposed. It needs to be removed.
All right, what's done? Okay.
Ms. Mayfield, I see you. I did want to give Sean and Ed a question or a chance to answer the questions around where's this funding coming from. I know that we've been talking a lot about the budget piece, so I know that was something that is of interest to, it sounds like, everybody. What is the availability?
Okay, yeah.
That was my question, Madam Chair.
Okay, all right, yeah, so just to quickly level set, looking at slide 11, as Deputy Director said, let's start at the bottom and work our way up. The $1 million at the bottom of the slide is already incorporated into the manager's FY25 budget recommendation. You won't see the $1 million per se, but there's a $5 million PAYGO recommendation for corridors. And $1 million of that $5 million would be considered like earmarked for this type of work. So, we know ultimately council will decide, it's your budget now, right? And you'll decide what to do going into June 10th. But as we've structured these, we're living within the means of what the manager's recommended budget included. So that piece is not new money, quote unquote. Now, when you look at everything above, So the Katie Blessing Center is obviously a project investment. All of the other ones are more like programmatic in nature. The manager's recommended FY25 budget also has a separate line item associated with $3.5 million of PAYGO to support and activate recommendations that come from this committee related to this referral and make their way to council. The reason that we've included $4.5 million in the call-out box on the right is just an acknowledgement of what Chair Watlington signaled at the most recent council discussion, where she interjected into the room the idea of increasing that $3.5 million by $1 million. And that was kind of tabled because that would be something that council would deliberate on as it relates to the $7 million of ARPA interest that's currently available. So we really tried to build this initial recommendation set around those numbers, living within our means. And then Councilmember Watlington, when you're done and your colleagues with the Q&A, if it's helpful, I'd be happy to provide a couple of thoughts on, ways to potentially think about what the next steps would look like. Or we can just respond to any questions or suggestions on that.
Sure. I don't see any more hands up at the moment, so you can go right into that. That'd be great.
Okay. So ultimately, it's the will of the committee, and all options are on the table. There's so many permutations here, I'm just going to simplify it into three to start. One is, depending on the level of enthusiasm for the committee today, you could advance the full slate of programmatic and investment recommendations to council. That would not be unlike how you handled the recommendations around anti-displacement from the Nest Commission in late calendar year 2023. If you went down that path, Chair Watlington, you would do a committee discussion report out on June 3rd, and then presumably this could be considered for action review on June 10th and a vote on June 24th. So I'm using that as one example. You could alternatively advance component pieces of what you've heard today if there's something or multiple somethings that you believe warrant quicker action in light of the fact that your summer recess starts after late June. So that's really the window of opportunity to do something before September. Or, of course, if it's the will of the committee, you could ask us to come back for further discussion on any or all items. So those are just three simplistic scenarios to kind of frame that.
And to that end, what we would be, if we were to do something today and on to early June in that first committee meeting, it would really be a recommendation to council, but won't actually be approved until the budget is approved. Is that correct, given that this is new money?
Right. Yeah, I did check in with Budget Director Bergman, and just playing out that first scenario, if there were to be a vote on these items on June 24th, there is precedent for doing that, where you're of course, it has to be after you've approved your FY25 budget on June 10th, but there could be an RCA at the end of June that contemplates the funding in FY25 starting July 1.
Got it. Okay. So I think for me, then my question to the committee members, thinking about what we're doing with looking at how we can optimize the budget, what if anything on this list would be desirable to move forward, knowing that means that we're essentially locking it in as a part of the budget that we would ultimately approve. So I think the question becomes, we know these ARPA interest dollars are there. That right now in the budget, there's $3.5 million in PAYGO set aside for this programming. The question is that $3.5 million something that at least those that are sitting on this committee are comfortable with keeping at that level in the budget? And if so, are we ready to commit it towards anything in particular? And then, of course, this $1 million from the corridors is already in there. So that's really the question: is are we believing that 3.5 that is in the budget is solid enough that we would make some kind of pledge against it, if you will? And then lastly, Sean, the other one piece of information that I would like is there anything on this list that needs to be addressed ahead of our recess? Because I think that's really that's a piece of information I would need to know. And then I see Vice Chair Mayfield.
So if we're still on slide 11, I mean, the first 1, 2, 3, 4, the first 4 rows, as I mentioned, are programmatic in nature, things that we can make bigger or smaller as needed depending on how much money is available. things that we can start sooner or later, depending on what decisions are made. The Katie Blessing Center, since that one is an active capital project fundraising campaign with a push among local funders to evaluate and make decisions, that is one where there's some time sensitivity associated with it.
Got it. Vice Chair?
Thank you again, Madam Chair. Okay, Sean, for clarification, out of these 6, the Katie Blessing Center is the one that has the most immediate need for us to make a decision, because we will be part of their fundraising campaign in order to say, hey, the city's got to come in, we need you to do a match.
Yes, just given that one's a capital project where, the vision will never be activated until there's sufficient fundraising to press go. So you can imagine that there's a lot of energy around trying to cobble together the coalition of the willing around that one.
Okay, so my other question, because we're saying this is just year 1, phase 1. The ARPA dollars are one time. Those, even though we're looking at the interest off of them, hopefully the market keeps doing what it's been doing recently, which has been on an up cycle. Potentially we can have new interest dollars, but to me, looking at this, we're really looking at a multi-year line item commitment. If we move forward with these and say we move forward with all 6, we know we're saying that we are committing to adding these additional funds to our budget line item, give plus or minus a little bit, because it might be a little more in one place and a little less than in another, based on the new requirements that we have already instituted or talking about institute to track our partners. But we're looking at a multi-year commitment of new budget line items, correct?
Yes and no, and I'm going to make a comment, and then I'm going to ask Director Hefner to weigh in, because she and I were talking about just that very question yesterday. She had a brilliant answer, so I know she's going to have a brilliant answer again today. If you think about all of the slides that Director Hefner went through, there are a lot of subcomponents to these categories, right? So there, depending on how the dust settles on the funding related to this, it's very likely that there would need to be some prioritization within those. You can't necessarily expect that we could do every single piece of that all coming out of the gates in year 1. So let me ask Rebecca to talk a little bit about the necessity to possibly whittle down in order to whatever is chosen to be done from a programmatic perspective to really be enabled over a multi-year period.
Thanks, Sean. I'm afraid my brilliance might have ended yesterday, but I will try to answer this again. And really, it just comes back to these recommendations are scalable. So depending on the funding that council you choose to invest, we'll go back through the recommendations and pick out the component pieces that can be advanced with that level of an investment. And some of them really do have a larger first-year investment. So if you think about something like the Social Norms campaign, right? In the first year, you need to hire the youth fellows and design the collateral and pay for the advertising. But then you might get less of a need over time. So the numbers really do reflect a larger first-year investment. So there is certainly a lot that can be done with just that year 1, kind of phase 1 investment opportunity.
That helps, because again, while we're looking at this budget and we're looking at potential cuts, even if those cuts were to include some of the staff, what I'm hearing is that there's probably an ask in Housing and Neighborhood Service of additional staff and or in CMPD if we're talking about expanding programs. And I think some of that is in the manager's budget, where they were looking for and I'm going to say the name wrong, but basically the community outreach people through CMPD. So that was a large number of individuals that they were asking for. Like for me personally, I can say I'm comfortable saying yes, we're moving forward for the Katie Blessing Center. I'm not as comfortable with some of these other dollar amounts without us knowing clearly what our budget is going to look like. Because I am pretty sure I have some colleagues that have some interest in trying to make sure we're not top heavy in our budget to make sure that we're financially conservative.
And I'll just add one piece to that, Councilmember Mayfield. None of these recommendations include staff and personnel costs.
Okay.
We recognize that these are pay-go dollars. That's always one time. ARPA interest is always one time. So we were careful to think about what we could activate using partnerships or our existing capacity.
That is very helpful for you to clarify. Thank you. And thank you all for, again, my committee colleagues have already said it multiple times. The work you all are doing is amazing. I just wish we had this conversation in September.
Totally concur. Like, great work, especially with all of the stuff that's going on, the considerations to make. So we appreciate you guys being conscientious and good stewards of our budget and also our youth and our outcomes. Ms. Johnson?
Thank you, Madam Chair.
Mhm.
So we approved moving forward with the Katie Blessing Center back in 2023, or we've approved this. I believe it was early 2023. So since that was already a plan, wouldn't some of that planning or those dollars already be included in the budget presentation somewhere?
May I jump in, Chair Watlington?
Yes, please.
So what was approved in January of 2023 was just the sale of the city-owned land in and of itself. And as I mentioned, it was a market rate sale. And the concept of the Katie Blessing Center was referenced in the explanation of the RCA, but council was not voting at that time to provide any direct support to the construction of the Katie Blessing Center. It was just the land transaction only.
So I mean, it's surprising, I guess, that wasn't included in the budget planning, that this would be a late addition, since we knew that, especially if it's here now, if it's something that needed to be considered in next year's budget, why that was not a part of the planning and why we're just hearing about it.
Well, they were, the site control obviously was early in the critical path, and it's really been only in the last few months that they've been gearing up on the fundraising piece. So we did not have a fundraising ask in front of us in January of last year. In fact, we didn't have a fundraising ask associated with this project in front of us until the last 40 days.
So it almost missed the budget opportunity, and it's important that we commit to it this year.
Well, I think, just to go back to, this is a different animal because it's a capital project in the midst of a fundraising campaign. And if you're on that side of the table trying to activate on the vision that I shared earlier, having funders step forward sooner rather than later is always beneficial.
So one of the things we could do as a committee, we could make the recommendation to move forward, and then the full council could consider it. And we would also have the benefit of having our budget director in the room and be able to discuss it further. That would be my suggestion.
Sure.
Thank you.
Yes, and clearly in that conversation, there would need to be more time spent on what's the specific value proposition the city most cares about? Because, we didn't have time today to pull back all the layers, but we should be intrigued by the idea that this clearly is a facility that would support Medicaid patients. This is a facility where it's the expectation that, predominant number of the individuals served would be from this particular community. So I think there are a number of things that we would need to get into to make it clear, not just why it matters to the Katie Blessing Foundation, but why we would be interested in helping to activate that vision because of things we care about.
Right, and if we move these things forward, I mean, as many as we can, or that we choose to, we can decide at the next meeting where we might cut other in other areas. I mean, there was a 14-year-old that was, I think our latest homicide victim as of this morning was a 14-year-old. So I think that this is something that we should move forward on. Thank you.
Madam Chair, may I ask a quick question? Councilmember Johnson, is that your motion?
That's exactly what I was about to ask.
Forward? See, because we in line, Madam
Yes,
Chair.
that's my motion.
Then I would second your motion.
Okay, we've got a motion on the floor. It's been properly seconded. I know that Ms. Brown has her hand raised, and then so does Councilmember Molina. Go ahead, Ms. Brown.
Thank you so much, Madam Chair, Dr. Wallace. So my concern was I know this project got kicked off before I was fortunate enough to earn my seat, but I'm trying to understand the capital campaign aspect piece of it. We have people already on board, or we're hoping that we push it out there, kick it off, and others feel the same way that we feel about it. Is it something that we're hoping once we move this forward to the committee that we could get funders, investors, people that want to donate on board with it? Or we pretty much know that this is something that's going to happen? And how long will the capital campaign be in place before we can say, hey, we got this, what's next steps?
So as I understand it, and certainly Sean, help me if I misspeak, but it's a private project. So Dr. Estramonte and his team are raising funds to the tune of, call it $70 million. It's just roundabout. What it looks like they've gotten to date is about 37 million or so. And they're asking us, based on what I'm reading here, to commit to 2.5 million. And I believe that our commitment will then incentivize additional stakeholders as well. I don't think, well, two things. So I hope that's clear. It's that the project won't start until they've got their funding, or at least enough of it to guarantee that they're going to be able to construct something. So you bring up a good point. Actually, it's possible that we commit this 2.5 million and the project for whatever reason doesn't happen. In that instance, we would just keep our 2.5 million is how I would imagine it be structured, similar to what happened with Brook Hill when we had earmarked 3 million. And if we need to be specific in the motion, I would be open to that as well, because I do think it's important that we make sure that we don't commit something and then nothing occurs. But because it's private, we don't really own the delivery time frame. But I think we can put stipulations around our funds if that makes folks more comfortable. Does that answer your question, Sean? Please jump in if I misspoke.
It does. You did a great job explaining it. I would definitely like to be more specific in the stipulations as we move forward with the motion. That will be my ask.
Got it.
Nothing to add here.
Ms. Molina?
You know what? Actually, I heard something that Councilmember Brown said, and I think that's my new thing. Thank you, Madam Chair, Dr. Watlington. That's actually, I love that.
We'll be here for days on that length of syllable.
Yeah, no, I love that. Thank you, Madam Chair, for allowing me to speak. And colleagues, I've been listening into your conversation because you all were a part of the body where we agreed to approve this for the East Side on Central Avenue. And I want you all to know that I am absolutely in support of your conversation. So even if you're, if it's the will of your body to bring it out, that I absolutely support you in some of the messages. I know that Council Member Johnson, this is her passion, and I could hear it. It's palpitating through the phone. I'm coming from a car ride line, y'all. I live in those in the afternoon. Be quiet, boy. Wow. And so I just, want to thank you for allowing me to listen in on your meeting and learn more. And I've also spoken to Dr. Estramonte, and, everything that Dr. Watlington said, of course, she already knows is great. So I'm just happy to hear. It's encouraging to hear that it's the will of your body to be on board.
Chair Watlington, we have 5 minutes.
Awesome. Okay, well, if there is no further discussion, I'm checking, then we can go
Motion.
Yep, we got a motion on the floor. All those, well, one thing, Councilmember Johnson, are you amenable to amend your motion that to reflect what Councilmember Brown was discussing?
I'm amenable, but we can't approve the money until it goes before full council. So, I mean, but if you all think that's necessary, that's fine. We can specify, I guess, contingent on what, if the project is completed, or if the rest of the money is raised. How would you suggest that we modify it?
Well, if it's not necessary, if it's not gonna be a stronghold, then I'm okay with that. If that's not necessary, but I just did want to raise, on record, I did want to have that
Okay.
on record.
That's a great point. Okay, yeah, I think the fact that we can't spend the money until we go in front of full council is important, or that's what makes it kind of repetitive or unnecessary.
Okay, no
Thanks.
worries.
Okay.
But point noted, and we will be sure to bring that up during the conversation with full council, because I think it's a good point. All right, cool. All those in favor?
Aye.
Aye, Councilmember Brown is in favor.
All right, I believe that is unanimous. Oh, I'm sorry. To that point, because we're on virtual, somebody in the room, keep me honest. I don't know where our attorney is. I heard Brown say aye. Johnson.
Mayfield said aye.
Okay. Johnson
Aye.
and Watlington's aye, I think. And I think that's all of us today. Yes. All right. All those opposed? Hearing none. Motion passes. Mr. Heath, do you need anything else from us?
Thank you for your time.
Awesome. Thank you, ladies. I appreciate you.
You all
You're
are
welcome.
amazing.
Y'all sound like y'all excited about this one now.
You all are amazing. Have a
Right.
beautiful day.
Have a great day. Wonderful day.